Insomnia is a common sleep disorder that makes it hard to fall asleep, stay asleep, or get enough restful sleep. Many people experience it at some point in their lives, whether due to stress, lifestyle changes, or underlying health conditions. Insomnia can be short-term, lasting a few days or weeks, or chronic, persisting for months or longer. The effects go beyond just feeling tired. It can impact your mood, concentration, and overall health. In this video, we'll explore what insomnia is, why it happens, and most importantly, practical strategies to help you sleep better. Let's start by looking at the different types of insomnia. Insomnia isn't just one size fits all. There are two main types: acute and chronic. Acute insomnia is usually triggered by life events, such as stress at work, exams, or a sudden change in routine. It often resolves on its own once the situation passes. Chronic insomnia, on the other hand, lasts for at least 3 nights a week over 3 months or more. It may be linked to medical conditions, medications, or mental health issues. Understanding which type you're experiencing is the first step toward finding the right solution. How do you know if you have insomnia? The most obvious sign is difficulty falling asleep at night, but it can also mean waking up frequently during the night, waking up too early, or not feeling refreshed after sleep. You might notice daytime fatigue, irritability, trouble focusing, or even increased errors at work or school. These symptoms can affect your daily life and overall well-being. Recognizing them early can help you take steps to address the problem before it becomes chronic. Insomnia can be caused by a wide range of factors. Stress is a major culprit, whether it's related to work, relationships, or finances. Other causes include anxiety, depression, chronic pain, medications, caffeine or alcohol use, and even poor sleep habits. Sometimes, medical conditions like asthma, allergies, or neurological disorders can disrupt sleep. Identifying the root cause is essential for finding the most effective treatment. Let's explore some of these causes in more detail. Stress and anxiety are among the most common triggers for insomnia. When your mind is racing with worries or you're feeling overwhelmed, it's hard to relax enough to fall asleep. This can create a cycle where lack of sleep makes you even more anxious, which in turn makes it harder to sleep. Learning to manage stress through relaxation techniques, mindfulness, or talking to someone you trust can make a big difference in breaking this cycle. Your daily habits can have a big impact on your sleep. Drinking caffeine late in the day, using electronic devices before bed, or having an irregular sleep schedule can all contribute to insomnia. Even eating heavy meals or exercising too close to bedtime can make it harder to fall asleep. Being aware of these lifestyle factors and making small changes can help improve your sleep quality over time. Certain medical conditions can interfere with your ability to sleep well. Chronic pain, asthma, allergies, and neurological disorders are just a few examples. Sometimes, the medications used to treat these conditions can also disrupt sleep. If you suspect a medical issue is behind your insomnia, it's important to talk to your doctor. Addressing the underlying health problem can often lead to better sleep. The environment where you sleep plays a crucial role in how well you rest. A noisy, bright, or uncomfortable bedroom can make it difficult to fall and stay asleep. Consider factors like room temperature, bedding, and even the color of your walls. Creating a calm, dark, and cool environment can help signal to your body that it's time to wind down and rest. Good sleep hygiene means adopting habits that promote consistent, uninterrupted sleep. This includes going to bed and waking up at the same time every day, even on weekends. Avoiding naps late in the day, limiting screen time before bed, and establishing a relaxing bedtime routine can all help. These simple changes can make a big difference in your ability to fall asleep and stay asleep. Light exposure has a powerful effect on your sleep-wake cycle. Natural sunlight during the day helps regulate your body's internal clock, making it easier to fall asleep at night. In contrast, exposure to bright screens or artificial light in the evening can trick your brain into thinking it's still daytime. Try to get plenty of sunlight during the day and dim the lights as bedtime approaches. What you drink can have a big impact on your sleep. Caffeine, found in coffee, tea, and many sodas, is a stimulant that can keep you awake if consumed too late in the day. Alcohol might make you feel sleepy at first, but it can disrupt your sleep cycle and lead to restless nights. Try to avoid caffeine in the afternoon and limit alcohol, especially close to bedtime. Regular physical activity can help you fall asleep faster and enjoy deeper sleep. However, timing is important. Exercising too close to bedtime can leave you feeling energized and make it harder to wind down. Aim to finish vigorous workouts at least a few hours before you plan to go to bed. Gentle, stretching, or yoga in the evening can be a relaxing way to prepare for sleep. Establishing a calming bedtime routine can signal to your body that it's time to sleep. This might include activities like reading, taking a warm bath, listening to soothing music, or practicing deep breathing. The key is to do the same things in the same order each night, helping your mind and body relax and prepare for restful sleep. Mindfulness practices, such as meditation or deep breathing, can help calm your mind and reduce stress before bed. These techniques encourage you to focus on the present moment and let go of worries that might keep you awake. Even just a few minutes of mindfulness each night can make a noticeable difference in your sleep quality. Cognitive behavioral therapy for insomnia, or CBT-I, is a proven method for treating chronic sleep problems. It helps you identify and change thoughts and behaviors that interfere with sleep. CBT-I is often more effective than medication and can provide long-lasting results. If you struggle with insomnia, consider seeking a therapist trained in this approach. If you've tried self-help strategies and still struggle to sleep, it may be time to seek professional help. Persistent insomnia can be a sign of an underlying medical or psychological issue that needs attention. Your doctor can help identify the cause and recommend appropriate treatment options, such as therapy or medication. In some cases, doctors may prescribe sleep medications to help manage insomnia. These can be helpful in the short term, but they're not a long-term solution. Medications can have side effects and may become less effective over time. Always use them under the guidance of a healthcare professional and focus on building healthy sleep habits for lasting results. Some people find relief from insomnia with natural remedies like herbal teas, melatonin supplements, or aromatherapy. While these options may help some individuals, their effectiveness varies, and they're not a substitute for good sleep hygiene. Always check with your doctor before trying new supplements, especially if you take other medications. One of the most effective ways to combat insomnia is to stick to a regular sleep schedule. Going to bed and waking up at the same time every day helps regulate your body's internal clock. Over time, this consistency makes it easier to fall asleep and wake up feeling refreshed. While a short nap can be refreshing, napping too long or too late in the day can make it harder to fall asleep at night. If you need to nap, try to keep it under 30 minutes and avoid napping after mid-afternoon. This helps ensure you're tired enough to sleep well at night. Staring at the clock when you can't sleep can increase anxiety and make insomnia worse. If you find yourself watching the minutes tick by, try turning your clock away from view. Focus on relaxing instead of worrying about the time. If you can't fall asleep after 20 minutes, get out of bed and do something relaxing in another room. Avoid bright lights and screens. When you start to feel sleepy, return to bed. This helps your brain associate your bed with sleep, not wakefulness. Reserve your bedroom for sleep and intimacy only. Avoid working, eating, or watching TV in bed. This strengthens the mental connection between your bed and restful sleep, making it easier to fall asleep when you lie down. A cool bedroom is ideal for sleep. Most people sleep best in a room that's slightly cool, around 65 degrees Fahrenheit, 18 degrees Celsius. Adjust your bedding in pajamas to stay comfortable, and consider using a fan or opening a window if needed. Noise can easily disrupt your sleep, especially if you're a light sleeper. Consider using earplugs, a white noise machine, or a fan to mask disruptive sounds. Creating a quiet environment can help you fall asleep and stay asleep through the night. A dark room helps signal to your body that it's time to sleep. Use blackout curtains or an eye mask to block out light from outside. Even small amounts of light can interfere with your body's production of melatonin, the hormone that regulates sleep. The blue light from phones, tablets, and computers can interfere with your sleep. Try to avoid screens for at least an hour before bed. If you must use a device, consider using a blue light filter or night mode to reduce its impact. Heavy or spicy meals close to bedtime can cause discomfort and make it harder to sleep. Try to finish eating at least 2 to 3 hours before you go to bed. If you need a snack, choose something light and easy to digest. Drinking enough water during the day is important, but try to limit fluids in the evening to avoid waking up for bathroom trips. Find a balance that keeps you hydrated without disrupting your sleep. Writing down your thoughts before bed can help clear your mind and reduce anxiety. Try keeping a journal by your bedside to jot down worries, to-do lists, or anything else on your mind. This simple habit can help you relax and prepare for sleep. Progressive muscle relaxation is a technique where you tense and then slowly relax each muscle group in your body. This can help release physical tension and signal to your body that it's time to sleep. Start at your toes and work your way up to your head, focusing on each area as you go. Guided imagery involves imagining a peaceful scene, like a beach or a forest, to help distract your mind from worries. Listening to a recording or simply picturing a relaxing place can help you drift off to sleep more easily. Simple breathing exercises can help slow your heart rate and calm your mind before bed. Try inhaling slowly for 4 counts, holding your breath for 7 counts, and exhaling for 8 counts. Repeat this cycle a few times to help your body relax and prepare for sleep. Certain scents, like lavender or chamomile, are known for their relaxing properties. Using essential oils in a diffuser or adding a few drops to your pillow can create a calming atmosphere that promotes sleep. Experiment with different scents to find what works best for you. Besides caffeine, other stimulants like nicotine can interfere with your sleep. Try to avoid smoking or using nicotine products, especially in the evening. Cutting back on stimulants can help your body relax and make it easier to fall asleep. While pets can be comforting, they can also disrupt your sleep if they move around or make noise at night. If your pet is affecting your rest, consider having them sleep in a separate room. This can help you get the uninterrupted sleep you need. Traveling across time zones can throw off your sleep schedule and lead to temporary insomnia. To minimize jet lag, try to gradually adjust your sleep times before your trip and get plenty of sunlight during the day. Staying hydrated and avoiding caffeine or alcohol can also help your body adjust. As we age, our sleep patterns naturally change. Older adults may find it harder to fall asleep or stay asleep through the night. Maintaining good sleep hygiene, staying active during the day, and managing health conditions can help improve sleep quality at any age. Children can experience insomnia too, often due to anxiety, irregular routines, or screen time before bed. Establishing a consistent bedtime routine, limiting screens, and creating a calming environment can help kids sleep better. If sleep problems persist, consult a pediatrician. Insomnia is just one of many sleep disorders. Others include sleep apnea, restless leg syndrome, and narcolepsy. If you have persistent sleep problems, it's important to rule out other conditions that may require specialized treatment. Keeping a sleep diary can help you identify patterns and triggers for your insomnia. Record when you go to bed, when you wake up, and any factors that might affect your sleep. Sharing this information with your doctor can help guide treatment. There are many myths about insomnia, such as the idea that everyone needs 8 hours of sleep or that you can catch up on sleep over the weekend. In reality, sleep needs vary, and it's best to focus on quality rather than quantity. Understanding the facts can help you make better choices for your sleep health. Getting enough restful sleep has countless benefits. It boosts your mood, sharpens your focus, strengthens your immune system, and helps your body recover from daily stress. Prioritizing sleep is one of the best things you can do for your overall health and well-being. Insomnia can be challenging, but there are many effective strategies to help you sleep better. By understanding the causes, practicing good sleep hygiene, and seeking help when needed, you can take control of your sleep health. Remember, small changes can make a big difference over time. Thank you for joining us on this journey to better sleep. Remember, insomnia is common and treatable. With patience and persistence, you can find the strategies that work best for you. Wishing you restful nights and brighter days ahead.